I'd like to call the Tuesday, June 13th, 2023 Finance, Audit, and Budget Committee to order. First item is Pledge of Allegiance. Pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, next item is adoption agenda. Need a motion to adopt.
Agenda.
Support Zinner.
Moved by Romano, supported by Zinner. Discussion.
Oh my.
Seeing none, please vote.
Motion passes 12-0.
Okay, next item is approval of minutes dated May 16th, 2023. Need a motion to approve.
So moved,
So-
Perna.
Support Nard.
Moved by Perna, supported by Nard. Any corrections to the minutes, commissioners? Seeing none, please vote.
Motion passes 12-0.
All right, next item is public participation. This is the first opportunity for public participation for those who would like to speak for a maximum of 3 minutes on an item which is on today's agenda. There'll also be a second opportunity for public participation for those who would like to speak on any issue. Would anyone from the public like to speak? Agenda items only.
Good afternoon, Commissioners. My name is Joel Rutherford. I live in Warren. Here today as a community activist, and I have to relay what's happening in the communities that I interact with. There's a lot of pushback in the communities about the ARPA funds being used primarily for the new jail intake. Everyone understands the need for more mental health and substance abuse assets, but putting them at the jail seems to be reactive and not a proactive approach to the problem. The idea is to get help to people prior to interaction with law enforcement, not afterwards. I imagine some, the commissioners will support this, but many in the communities I interact with won't. They would like to see mental health professionals out in the public doing outreach to help people with mobile health clinics and other things like that. Of course, more beds are needed, more substance abuse and mental health treatments needed. But at the same time, the jail seems to be not a community-focused effort, but more law enforcement or incarceration focused. So much can be done with the ARPA funds and using the funds for community improvement programs, such as affordable housing, other things that are needed throughout the county, along with mental health and substance abuse treatment, would seem to be a better way of spending these funds. If the executive hackle, Sheriff Wickersham, along with those in the board or the commissioners want a new jail, please seek a millage to make that happen. Using a lion's share of the ARPA funds to avoid the voters doesn't seem like the best use of funds or have it do what many residents believe the funds were intended for. One thing ARPA funds are, it's a one-time good deal. There's not going to be anything to follow up on that. And this expansion of the jail seems like you're going to have to add staff, you're going to have to add other things. How is all that going to be paid for? I thank you for your time.
Anyone else from the public like to speak?
My name is Dr. Ian Boyer. With all due respect to the gentleman, I absolutely disagree with his assessment. I can tell you real briefly, as succinctly as I possibly can, I came to Macomb County in 1972 because Chief Judge George Denowith and this Board of Commissioners requested probation services that weren't previously given. I developed a volunteer probation program with over 500 citizens working in conjunction with circuit court and district court probationers in Macomb County. In 1975, Sheriff Almstead was working with a board of commissioners who had requested and demanded to expand the jail because of the need and to bring programs to the jail. Consequently, I left my job as a probation officer, came and worked at the jail, worked on a law enforcement assistance administration in conjunction with the board of trustees that wanted programs in the jail. Consequently, we developed a education program in conjunction with Lions Cruz Public Schools, substance abuse programs, workforce development programs that never existed before to prevent recidivism. People were coming to the jail, they were incarcerated, and we had an opportunity to make a difference. Ladies and gentlemen of the board, today you have an opportunity like no other. This board for the last decade has been involved in working with Sheriff Wickersham, County Executive Mark Hackle, and others to get to this point, to expand the jail, and more importantly, to bring programs to prevent recidivism among people who are mentally ill and have substance abuse. I remember full well when Mark Hackle was a lieutenant at the jail, and he said to me, "Don, we need some kind of programming, some kind of facility to deal with people who are mentally ill, have substance abuse problems because they are causing death, destruction to the citizens of Macomb County in a variety of different ways. We need to do something." And I said, "Mark, you're absolutely right, but we don't have money, we don't have the availability to do it." Now before you, through the American Rescue Association Fund, we have funds finally available without expense to the taxpayers to really make a difference. In 1984, we were under construction of building the new tower to the jail. We didn't have enough room for all the inmates that were being incarcerated that were for the county, nor did the state. Some of you will remember there was severe overcrowding in the state. Consequently, Sheriff Hackle and I we met with the legislature, we met with the governor, we got $16.5 million because we needed to expand the jail,
You have
add
30
more
seconds.
floors to house county prisoners, to house state prisoners for the protection of the public. Consequently, that money came to the county. We had a situation before the new correctional facility was built on 26 Mile Road. We housed state prisoners. We amortized $16.5 million, no expense whatsoever to the county of Macomb. We added a floor that we needed on behalf of the county, on behalf of the state, and it made a difference. We added programs to meet the needs of those people that are coming. Every one of us, directly or indirectly, is affected by mental health issues. You read about it in the paper, you hear about it in the schools, it's transpiring, the substance abuse problems are transpiring. People are coming, they're not receiving services in the jail. I remember
time is up.
Sorry, get carried away with this. But let me just say one thing. The people that work in the jail have an horrendous problem. The police officers in St. Clair Shores, Warren, Sterling Heights, and everywhere else in the county of Macomb have a problem with people that are mentally ill because services are not available to them. We have an opportunity to provide those services to people. And God, I hope you'll vote in favor of this. Thank you. I'm sorry for getting carried away, but thank you.
Thank you, Doctor.
Never heard of
Anyone else from the public who'd like to speak? Anyone from the public? Agenda items only. Going once, twice. We'll close public participation. Next item is the American Rescue Plan Funds project items. All items are for discussion and will be forwarded to the July Finance Audit Budget Committee meeting. So I'm going to take a motion now for items A and B to receive and file and forward these to the July Finance Audit Budget Committee.
So moved by Nard.
Support Hall.
Moved by Nard, supported by Haw. I know we have Public Works Commissioner here, as well as Brian Baker. So, Commissioners, any questions related to items A and B specifically? Trying to get to that screen. Chair Brown, you had your hand up, but I don't see your name, so I'll recognize you at this time.
Thank you. Sheriff, a question for the sheriff.
Sheriff Wickersham.
Well, the drain, this is drain. You're overshadowed, Commissioner Miller. Commissioner Miller, you have a nice day. I have no questions for you or your projects. They're needed and overdue. We're happy to help. Thank you.
Commissioner Miller, do you want to address the board? Please address the board.
I just want to tell you all how sincerely, and I mean this sincerely, how much we appreciate. It's a lot of money. So we very much appreciate the Board of Commissioners' willingness to invest in infrastructure, these critical infrastructure projects, and water quality, quality of life for our residents here in Macomb County. And all of that is a critical component of economic prosperity. So we are very appreciative of your willingness to support our projects. Thank you. Have a nice day.
You're welcome. The money
on,
we
Commissioner.
spend with that department is money that's less money that taxpayers have to pay for water bills and sewer rates. We're getting a return of their tax dollars back from Washington that's being put into the ground so that the residents don't have to pay higher rates for their sewer and water bills that would otherwise have to be paid, because that work must be done, like other subjects we're going to discuss in a minute. But I appreciate that, and looking forward to seeing it done. Sooner the better. Thank you. Thank you, Mr. Chairman.
Any other commissioners related to items A and B? I have one question. Commissioner Miller, she's here. So Commissioner, all of your projects are ready to go, would meet the deadlines related to the ARP fund guidelines, correct?
Yes, actually, number one, which is our in-system storage for Chapaton, is well underway already. So bills are coming in, I'll just tell you. And the electrical, also for the pump station down there to replace all those the screw pumps. We just awarded that bid yesterday. Commissioner Lucido was at the drain board. So we're going here. We're just going. Bills are coming in. I just point that out.
Okay, great. Thank you.
Thank you.
Seeing no other questions, please vote.
Motion passes 13-0.
Thank you for being here, Commissioner. I know last time you had to wait until the entire presentation to have your presentation. So this time we put you first. Okay, next items will be items 6C through F. I need a motion to receive and file and forward these items to the July Finance Audit Budget Committee meeting.
So moved by Nard.
Perna.
Moved by Nard, supported by Perna. Commissioner
may?
Romano?
Chairing this, if I have the support, I'd like to see this move to full board. If I can get a support for that instead of chairing it, I think we've had this coming along for a long, long time now. You've heard speakers, you've heard our executive, I think you've heard Sheriff Wickersham, he's been here. We've had this for a while, we've had a lot of questions, we got a lot of answers. I think it's time to move forward now. We can bring it up to full board. The money that is spent or not spent, I should say, would be returned. I think it's time, I personally feel it's like kicking the can down the road, and I'm not ready to do that. So if I can get support now, I would like to see this move to full board, and I will make that motion. I know there's a motion on the floor, but I'd like to see a motion made to move this to full board.
Support by Nard. I support that.
Commissioner, there are 19 questions that were docketed to go through here
I'm
today.
only speaking of item number C.
C through F are all intertwined.
I'm sorry?
C through F are all related.
They're all related. Then I'll move C through F to full board.
So you want to negate the discussion of 19 items that are supposed to be discussed?
Well, I think we've had a lot of discussion on all of these items. I think we've had a lot of questions. In fact, I see a whole stack of questions and answers on all of these items. And I think it's time this board made a move, yay or nay. And if we're not going to support the new jail or the intake, then let it be said, and we'll go to item number B or C or whatever it is. But at this point, I think this board should make a decision, yes or no. We want to support it or we don't want to support it. It's not a very difficult question or to move it up to full board. And as I said, any money not spent will be returned. And if the board feels they don't want to move this to full board, so be it. But I'll make that motion to move it to full board for Thursday.
There's already a motion on the floor.
I know there is.
Yeah,
Chair?
I'm not going to accept that motion at this time since there's already a motion on the floor to discuss.
Well, can we have the makers of the motion remove their motion?
Who made that motion?
I did.
Commissioner Nard.
Commissioner Nard, do you want to amend your motion?
Oh, my goodness. I mean, if there's questions, I mean, I do want people to, are people going to be still able to ask their questions?
Yes, but
okay.
he's asking them to vote on this and to move this to full board, rather than bring this back to this committee next month.
Just point of information.
I would agree with them. Okay. I mean, we've been talking about it for quite a while. It has to be done. It needs to be done. So I would concur with them, yes.
Commissioner
Go
Perna,
ahead.
did you?
No, the question was, if we move it to full board, we can't ask any questions at this point.
Is that what that is? We can't ask questions?
No, we can still ask questions. Commissioner Romano's asking to have a vote on this rather than
Then wait till next month?
wait until next month to make sure
Okay.
all of our questions and answers, or all of our questions have been answered.
Because we're going to be asking questions today, right?
Correct.
Okay, so yes, I agree with them. We need to go ahead and stop kicking the can and just go ahead and make our decision.
No, but we're gonna vote on it first, not to interrupt.
We're going to vote on it to go to full board, correct?
Correct.
It was
He's asking
seconded
for-
by Perna, so will we need both the motion maker and the second?
Do you withdraw your second?
Commissioner Perna?
I didn't make a motion to second.
You supported her motion.
You supported her,
Yes, I did.
so do you want to support Commissioner Nard's motion, her amendment to her motion?
No.
You do not. Okay, does anyone want to support Commissioner Nard's motion, her amended motion?
Can I support that?
Yeah, you could.
I will support it.
Okay. All right, so the motion is to move the items C through F to full board. Is that correct?
That's correct.
Okay.
After
Point of
discussion.
order. You had the first motion to move it to next month's committee. The mover and the second have to agree to eliminate that motion before you can take a second motion.
I'm sorry, was the maker Nard originally, Commissioner Nard and Commissioner Perna originally?
Commissioner Perna originally.
Okay, so then I stand corrected. So we need a new motion on the floor, correct? Well, we have a motion on the floor
Have a
then
motion on the floor.
to
Both
move this.
have to agree
So I have to
withdraw
remove
the
that first
motion.
one?
You
Yep.
have to withdraw and so
Correct.
does the second.
Since Commissioner Perna supported your motion, he's not supporting your amended motion.
Okay,
He's supporting your original motion.
okay, well. So what do we do?
So you
Motion
can't have
fails.
a second motion
So
as
just-
long as
just-
you have one on the floor.
So we'll just
So
keep it as
first
is.
we
I
have
guess
to
we'll
vote
just
on it
Correct.
continue.
So
Okay.
so the motion that's on the floor right now is to receive and file and forward items C through F to the July Finance Audit and Budget Committee meeting.
Correct.
To the July.
Did I say August? I meant July. First speaker is, well, before we get into the speakers, so my thought process for the discussion purposes today was we had 19 questions that were submitted with answers, and I think there are follow-up questions related to these initial questions that were brought to the executive. So I'd like to go through these reasonable amount of time, but I will recognize Commissioner Song first since her name is on the list.
Here
Commissioner
we
Song.
have to vote on the motion that the two of them made to postpone it.
I
to
don't
the-
believe so. We still need to discuss before
No.
we vote.
Well, our policy has been a motion, support, vote, and then discussion. No?
No.
Okay,
We gotta talk about it.
so we're not voting on it.
We are after the discussion.
Okay, thank you.
So after that, Commissioner Song, you have your name on the list, so I recognize you
Thank you so
first.
much, Chair. Just a few points that I want to make. During the pandemic, we've seen the population in the jail go down. Nonviolent offenders could be released back into the general population without any issues. So I just believe that, instead of us expanding the jail, we can look for ways to reduce that footprint, because we've seen during the pandemic that we could reduce the population in the jail. Second point I want to make is this is a one-time funding that's ARPA dollars, but it's still taxpayer dollars. So either way you look at it, the taxpayers have paid for this money that's coming back to us. And the third point is, I believe a lot of people, at least in Warren, have been very supportive of millages when it comes to police and fire. And so I actually think that that might be a good option to go, because I think if people would be willing to support the renovation of a jail, I believe our residents should have that opportunity to make that vote. And then the last point I want to make is that this $50,000 that
Million.
no, this $50,000 that's included in this $228 million is not guaranteed from the state. So I'd like to know what is your plan if this money is not passed down from the state legislature?
So is that your question, Commissioner?
That's my question.
Okay, so
Thank you,
who would
Chair.
like to answer the question related to funding specifically? We'll start there, because that is one of the questions on the list, so.
$50
Good afternoon, Commissioners.
Big question.
To clarify, it's
Thank you,
50 million.
Yes.
Yep, and the plan is, and Steve can go into details, I know it was on the list, the plan would be that we would need to seek bonds for the 50 million. And I know, if I can add to that, I know there were a lot of questions that came up in the past 2 days, and there's an impression out there, it's not the same impression that we have, that we are not getting the money. So I'd like to clarify again, we made phone calls again today. While yes, it's not 100%, and we agree with that, some of the statements saying that we're not getting it, that's not what we're hearing from the governor's office, from legislators that we've talked to, Speaker of the House. It is still one of their top priority projects. Still don't have a date for when, of course, going to acknowledge that, but.
And
I
Vicki, just
wanted
to be
state
clear
that.
before Steve speaks, so you're in need of $100 million, of which 50 million you're looking to take from the general fund and 50 million you're looking to bond. Just to clarify that is what you're proposing.
50 million from the state is the proposal currently. If that money doesn't come to fruition, we would most likely, almost certainly have to issue bonds, assuming all other costs come in at 100%, including contingencies.
And if, sorry, Commissioner, I'm just trying to clarify this for the
No
other
problem. I
commissioners.
guess it is 50 million, not 50,000. My apologies. $50 million, that's a lot of money. That's half of our general fund dollars. And so I would just really like to know, and I don't know if other commissioners have a concern about this, but how this proposal is being laid out is that you're hoping that the state will appropriate $50 million. And I'm not convinced that they're going to do that, not until their budget is set and, they've made that decision. So that is my concern. And if your plan is to bond, then I think that needs to be a part of this proposal. And there's nothing in here that has any fallbacks.
Well, of course, yeah, the proposal is assuming that the state would get money. What would happen is, if that falls through, we would come back with an amended plan. But as you correctly pointed out, 50 million is about 50% or half of the general fund balance. So we're using half under the proposed plan, could not draw down the other half and bring it basically down to zero, of course, so.
Thank you, Steve. Thank you, Chair.
Just to kind of follow up, because this was one of my questions as well, in regards to that, Steve. So the proposal is to receive 50 million from the state, to bond 50 million. If we do not get 50 million from the state, then are you insinuating that you would be bonding for 100 million, or you would be
50
taking
million from the fund
50%
balance, regardless.
regardless?
50 million either from the state or through a bond issue.
Okay, so you're splitting it. Just wanted to clear that. Commissioner Lucido.
Thank you, Commissioner Sabatini. So my biggest concern is, I understand the need for this upgrade to our jail. I do realize that our jail is in very poor condition and does need some upgrades. But with that said, I feel like with this ARPA funds, a better use of it would be to try to prevent people from going to jail in the first place. There was a lot of talk about like mental health issues and drug addiction, but if there was a way that maybe we could utilize some of that funds to help prevent those people ever even walking through that door to begin with, I think would be a more beneficial way to spend that money in this community, because that long-term is helping everyone. It's would cut down maybe on different crimes and thefts and even petty thefts and things like that if we were able to do that. With the amount of money that we're talking about spending, we could hire 58 professionals every year for the next 20 years and pay them a professional salary, 58 people that we could put out in the community to help give more services. And even in the jail itself, at 827 on average per year, those 58 people, if they all seen 14 and a half people, that's all they'd be servicing is 14 and a half people each. And I mean, realistically, obviously that's not gonna happen. We're not gonna eliminate everyone from going to jail, but I don't know. And so I guess my question is like, has there been any talk about like, because I'm new, so it's hard to say about before this, of just like increasing our mental health facility and because I know there's a waiting list. There are waiting lists in the county right now for people to get mental health services. There's people that need to get their kids services and things like that, and we don't have the professionals to help them and give them those benefits, and that's not helping anyone. And so has there been something looked at that would, before this was brought up, to maybe expand those kind of programs?
So, yes, it's all part of a system and a large system, and they're all connected. And, you know, when we look at the jail, we talk about the jail's county responsibility. And we have issues in the jail, multiple that need to be fixed. And yes, we talk about programming. There's programming that has been expanded in the jail. We had brought before you a new WellPath contract to increase mental health services within that contract. Community mental health, which Dave Pankatai is here and can speak to more than I can, as can Barb Caskey. There's other programs in the jail that we've been utilizing and that they have funds for within the jail. When we talked about our opioid plans last month, those are opioid dollars. However, there's the mental health component to that. There are programs within that plan as well to put services within the community. So yes, we are working at that, but it's very large, and we recognize that. And you know, we're focusing again. You mentioned it's one-time money. The jail has been an issue for years that has never been solved. It's an opportunity to solve it with hopefully utilizing no additional taxpayer dollars. So yes, we're not ignoring those facts, and they're there, but just as the jail is complicated, so are the community programs. But yes, we have those built in now as well as into the future. And, you know, there's other expansion programs if the jail project moves forward, if our opioid plans move forward. When we brought the opioid plans, we talked about the Crisis Stabilization Unit, a local residential treatment center. We've talked to the board about utilizing the JJC for that. We're in discussions with the state to utilize that facility and open up more of those services and use other available funding for that. But we need some of these other pieces somewhat to go first to have all of that come into play. I don't know if Dave or Tony wants to expand, if I missed anything. Stop.
Thank you. I'm Dave Pankatai. I'm the Director of Community Mental Health. To your point, we are actively working to expand our services across the board. We've issued capacity building grant opportunities for our current providers. We're actively looking to bring on additional providers to help meet our needs. We are expanding our mobile crisis services. We have vendors in place already through the RFP process for a 24/7 engagement center, which would help people with substance use issues, possibly divert from a jail or an emergency room. We've also worked with, through the RFP process, we have a vendor for a jail diversion program. On a larger scale, it would be residential, short-term residential, help them stay out of the jail system and go back into the community. We are looking at a 24/7 crisis stabilization unit where first responders, families, individuals could go. They would be assessed and then directed to a crisis residential facility or an inpatient psychiatric hospital, some of our intensive community outpatient programs, or routine outpatient programs, depending on the way they presented. So we have all of those plans going on and in place, including increasing our partnerships, collaboration with first responders across the board. Revenue is good, finances are good, the needs, as you've stated, have increased dramatically. Children in schools, everybody's experiencing more and more problems. We're able to see more people than ever. We used to be very limited. We had to screen people in. You had to meet the Michigan Mental Health Code criteria for serious mental illness. The state, through a demonstration project now, we can see people who are less severe than that. Our biggest bottleneck right now is it's been the staffing crisis. Our providers are struggling. We've been supporting them as best as we can, and then we're trying to grow and add staff as well to meet those needs. So it's more of a staffing resource issue than a revenue finance issue right now on our side. And I'm happy to answer any questions.
Commissioner Lucido, any other questions?
That's all I have at this moment.
Thank you.
Commissioner Nard.
I realize that this project is quite expensive, but my concern is people are not going to stop going to jail, number one. Number two, it's very difficult to tell mental illness. You may have somebody performing normally, working a good job, and anything can happen and they snap and they could kill their family and anybody else that comes up. So we can't play games with saying we're going to put professionals out in the field to do this. That's going to cost money too. But mental illness is very tricky, and these people are almost like chameleons. They will act like they're okay, and they're really not. I don't know if anybody saw the session where the officer was in the store buying some potato chips, and the guy walked up to him and snatched his gun from him. He didn't expect that. You have to have something mentally wrong with you to do that. Who could have predicted that those 3 young men were going to try to take that officer's gun and wrestle with him that way? The officer could have killed him, but he didn't. So we can't play with mental illness. We know we're going to have to house people. That's going to happen. My next concern is the officers that have to be in those facilities are doing time as well. When I went to that facility, I was sick for 2 weeks. I had to see my doctor. That was awful. It just is what it is. And so I'm concerned about those men and women that are in there 18 hours, 12 hours a day with these mentally ill people. We need to make sure that place is safe, not only for the people that are in there, but for the people that are working in there. So I understand the ticket is high, but that's what it's going to take. And if we continue to keep waiting and waiting, it's going to get bigger. So let's get it taken care of. That's my opinion. That's my thought on it. I know a lot of people got a lot of things that they feel, but I've worked with mentally ill people. I've been in contact with mentally ill people and didn't even know they were mentally ill until they lashed out and did something. Thank God I'm still here, and thank God some of my family that got killed are still here. But my niece didn't make it. She thought that the man was okay. And 30 minutes later, after we got off the phone, he blew her face off. He was mentally ill. Nobody knew this. His family didn't even know that. So we can't play with that. And they're walking around like normal people. And it just takes one little thing to make them snap. And we need to allow our officers and the jail, the people in the jail, to do what they need to do. Yes, we need mental health out there with them, but how many people that are trained to be a psychiatrist or a psychologist is ready to wrestle somebody that has mental illness out in the field with an officer? Not many. That's a whole nother training and some more money we're gonna have to spend. So what we got now is what we got, and we need to expand or whatever we gotta do so that we don't have some accidents and incidents coming up in that jail and every place else. That's just my opinion, guys. Thank you.
Commissioner Van Sickle.
Thank you, Chair. To spring on what Commissioner Nard just said, I think some people, it's very difficult to tell that they have mental health problems until they actually do something. So I don't see the jail intake center, maybe it's not a good name as a jail intake center. Maybe we ought to have it
The
called
name.
an evaluation center or something. I'm not good with names, but I see it as one way to keep people out of jail, to help treat the mentally ill people and to get them the help that they need. Because like I said, sometimes you can't tell people have a problem until they actually lash out.
That's it.
And so I also agree with Commissioner Lucido. It would be good to not have people in jail, but I see the intake center as something that will help to that end, to not get people into jail. On the other hand, life is very complex today, and financial issues are something that adds to people's stress. And the constituents that I have do not want to see additional taxes. So I would not want to bond for the extra $50 million. Can we do something in construction of the jail to move some of the cost to next year or the year after that? Can we build the 4 floors and maybe not facilitate the actual jail cells in the 4th floor this year and put them in next year with next year's money so that we don't have to bond? Because I'm not really for raising taxes on our constituents. Vicki?
Sure, I'll try to answer a piece of that, and then Steve can answer a piece too. So when you look at the budget amendment is just capturing the dollars. Obviously, that's what we're trying to do for the full project as we know it, to set that money aside. You then have 4 contracts before you for approval right now, which I think total roughly 17 million. That's the money that would go out the door in the coming months. Plans to spend significant portions of the project won't come until later, and of course the board will see those project areas. So when we look at going to bond, by that time we will have a bid back for construction costs, what it's gonna cost. You know, and depending if it's higher, you know, we wouldn't like that, of course, but we do have contingencies. But if it's lower, we would adjust, and that's all part of project management for that, and we would come back to the board. So in some ways, to your point, if we don't get the 50 million from the state, we would be coming back and looking at, maybe we'd only have to bond for 30 million. Maybe we do really well on the fund balance within the budget. Maybe other grants come. We're not stopping looking for money as we move through this process, but we had to start, we knew we had to come with a full picture, because I don't think you'd be comfortable either approving somewhat a guesstimate or only a smaller amount, and then it grows. So what we did is came to you with the full picture. We're asking for the budget amendment to set the money aside, but we will be back. And again, best case scenario is it comes in lower, and then we can adjust the bonds. Maybe there's other grants or other funding sources that come to play. And Steve, I don't know if you want to expand on some of the other.
No, I think you stated it very well. I don't know if she answered your questions, Commissioner. One way or the other, if the money from the state doesn't come through, we need another 50 million from the general fund, whether it's this year, next year, 2025, et cetera, et cetera. And will there be another $25 million or $50 million over 2 years in accrued surpluses? I don't have a crystal ball. That's a lot of money in 2 years. So I would say unlikely.
I don't have a crystal ball either, and around here, I've observed very few things coming in under budget. So I would expect us to use at least some of the 34 million that's in the current proposal of contingency monies. Again, I'd like to see it get down to where we're not going to bond, and if we can't take a piece of the project and move it out so we can actually pay for it next year, then can we make the project be enough less that we can get rid of the 50 million?
I think, Vicki addressed that. A year from now, we'll have construction documents. We'll know what costs are. Is it gonna be 50 million less? My personal view is probably not.
Don't know.
Yeah, you don't know.
And I don't like voting on don't knows. Thank you. Thank you, Chair.
Commissioner Ha.
Thank you, Chair. There's probably a million different ways to spend these ARPA funds. I'm sure if we polled every one of us and everyone in the audience, there would be different criteria or issues that they would see as a priority. We talked about building a new jail. I think the cost was $450 million a couple years ago. Didn't want to go out to bond, didn't want to raise taxes. This money became available through the federal government and looking for additional funds from the state to address an immediate need. We, the Macomb County people, own the jail. It's in dire need of repair. They've reduced the cost some $300 million. Do I like the term intake center? Absolutely not. What I see it is an opportunity to bring the facility into some type of modern day times. We've heard the sheriff tell us every time he goes to court, the first thing they ask him on a lawsuit is, what have you done to improve the jail? It's why we're losing lawsuits. We have done very little, yet invested millions with Band-Aid repairs on this jail. We use the term safe and healthy Macomb County. These people that are being incarcerated that have mental health issues are not being evaluated, are being put into the penal system. That's not where they belong. They belong and deserve help. Can we solve the mental health crisis in this country? No. Can we solve the opiate crisis in this country? No. What we're doing is building a little bit of brick, similar to what we just approved without a single question to our good friend Candace Miller, who asked for money to improve an infrastructure that's been deteriorating for decades. Recognized the need, did what we could do with the money, and didn't question it. Now we're dealing with a jail. Not a popular subject. We've had the attorneys come to us time after time and say, this is why we lose lawsuits. Can't even defend them in most cases. We just end up paying. This is an opportunity to get an incarcerated person help that they need to get them into the right place so that they possibly don't go back out and repeat a crime. Because that's what's happening. They're getting released from jail without any services or any help and repeating crime. He told us that. He being our sheriff, our representative, just like Candace is for Public Works, he is for the Sheriff's Department. We listen to the experts. Do I want to spend all of this money on a jail? Nope. Am I willing to do that because of the need and the hope that somebody doesn't come out of that jail with a mental illness problem and go hurt somebody again. The expert has told us there's a need. Our job is to assess whether or not we want to spend that type of money. I get it. Everybody's got a different issue. Hunger issues came up. Housing issues came up. This is not the genie coming out of the bottle saying you can solve all the societal and economical issues in Macomb County. This is one singular issue. Just like Public Works was one singular issue. So do I support this project? 100%. Do I think, having been in Lansing, we're going to get the 50 million? We've talked to the Speaker of the House. We've talked to the Speaker of the Senate. We've talked to their underlings. Alls we can go by, we went through the same thing with Martha Teaberry. Are we getting the money? Yes. Did they get the money? Yes. Do we think we're going to get the money? Yes. Do I know we're going to get it? No. That does not replace the need. Either we listen to the experts or we don't. And Don, I want to thank you for bringing your issues and the history of this issue to all of us. That's all I have, Chair.
Commissioner Wallace.
Thank you, Chair. I am not going to go back over like everything I've said before. It's still the same. But I do have a question because Dave brought up a lot of great initiatives that he has planned or is in the motion or in motion. Are any of those covered by ARPA funds? So those are CMH things that are. Get those steps in, Dave.
Guess me nodding in the back is sufficient for a meeting like this. We currently have the financial resources to implement those programs, so they would be supplemented by the ARPA, perhaps on the jail side, and then the opioid settlement dollars would be, like commingled, available to us as well. And on the side of the opioid settlement too, it's been a real benefit to the CMH being a department of Macomb County here. In the other regions, the opioid settlement dollars are coming to the county separate, completely separate from the community mental health system. Here in Macomb, we've been right at the table about how to best utilize those funds. So yeah, it's a real benefit to us here. But
Yeah,
the ARPA dollars, the programs that I mentioned, we could move forward without tapping into those at all right now.
So when you say, well, two things. One, I completely can see your involvement with the opioid funds. When you say supplemented, what exactly does that mean?
It's too early to tell. It's very early, but as part of our crisis continuum, having a program in the jail, expanding our current jail diversion program, which we do in collaboration now with Community Corrections, and then our new, separate residential jail diversion program, and then expanding our crisis screening services into the central intake on the jail site would all be possible.
Okay. So that would be evaluated later then. Like if you'll be able to actually implement that into the possible intake center.
Yeah, and we could do crisis screenings there if needed down the road too. I know there's currently a vendor in place in the jail for medical and some mental health. We could look to expand that in cooperation with the other county departments too.
So what are we doing now?
Right now, we have a jail diversion program And like I said, we're doing that now in collaboration with Community Corrections. So we have CMH staff working with Barb Caskey and Community Corrections, but we're not providing any other mental health services to the jail currently.
Possibly last question. So you have that with Barb, but it's not within the jail yet. So do you need the intake center to do that as a part of the jail or to help?
Well, they're showing up there, so yeah, it makes sense to, collaborate and have the community mental health. As I described, the 24/7 crisis stabilization unit that is currently in planning, there's a need, we could evaluate the individual and then divert to other resources within the community mental health system or in the community, or make a determination along with the Sheriff's Department that, yeah, they have to go to jail. And then it would be what supports do they need while they're at the jail.
So right now you're working on the diversion and you're working on the 24/7. Do you need a minute?
Vicky's reminded me, yeah, we don't have physical space, but it would be like we do in the local emergency departments now, where we're able to go in and provide those services.
Right. Okay. So like I was saying, you have the diversion center, or you have your diversion program that you're working on. You're working on the 24/7. And then if the intake center is brought in or added on or what have you, you would be able to implement what you're already working on to build in the county with the jail.
Yeah, it would be a collaborative.
Okay. I think that's it, but I love that this is something from a CMH standpoint that you're already doing within the county. I know that with your efforts, Macomb County is a great example in the state. There's been great turnaround. So thank you for all of what you have done so far, and I look forward to everything else that you have planned.
Chair Brown.
Thank you. This question for the sheriff. Sheriff?
Yes, sir.
Your facility right now has a need for additional mental health cells to help house people with medical issues and mental health issues, right?
Correct.
But you have a shortage of them, right?
Right. So before you start, and I'll answer your question,
Sure.
can we all agree that it's a replacement? It's not an expansion. Because when you use the word expansion, it makes it sound like the sheriff wants a bigger kingdom. The sheriff doesn't want a bigger kingdom. Sheriff wants something that's operational. So this project that we're talking about is a replacement for a terrible, outdated, pretty much an unsafe environment for not only staff, but inmates. John Shapka right now is probably cringing, but I speak the truth. Just to let you know, we had a corrections officer take a beating last night by a homicide suspect in the mental health unit. Sent him to the hospital. Thankfully, he went home last night. So just keep that in the back of your mind when you're making decisions about the Macomb County Jail. And not just the people that are coming in that are getting arrested, but the individuals that are working inside that facility. I'm ready for your question, sir.
Okay, well, thank you, Sheriff. I'm glad that our officer wasn't seriously hurt, that he couldn't go home. But again, speaking about the mental health, additional the jails, the cells that you want to replace or put in the new building. Right now, we don't have enough. So those mental health patients are commingled with the general population?
So we have mental health people housed in our mental health unit, which I think all but one has toured the jail.
So you have seen that mental health unit. We have to move other individuals down to our, we call it the booking desk, which would be the central intake and assessment facility. You know, my staff on a weekly basis is basically playing chess on where we're gonna house individuals and how are we gonna supervise them. You know, we have individuals that go on one-on-one status where that's one officer watching one inmate. And that creates logistical issues for the staff. And then on the weekends, we have 50 weekenders coming into the facility where we have to find room for those. But yes, we need additional mental health and additional observation, detoxification, medical cells to properly supervise the inmates that are being remanded to the county jail.
You kind of already answered my next question, was what are the risks? Not only to the people themselves, those with mental health issues, the population, but to our staff.
The risk is higher. Again, the way it's supervised, the way it's set up, the staffing, making sure that we have the proper staffing. Again, in this situation, he's in the unit. And once the flight's on, you know, it's an all call and you've seen it. You got to go upstairs, you got to get up elevators so somebody can come and help him out. The duty officer can't leave that duty station or it could be overtaken and we'll have, 15, 20 mental health inmates running the facility, so.
Will additional staff help monitor those situations, those people in those cells?
Well, yes, I would say if we could have additional staff, and again, we were granted additional staff in this budget and we're working to fill those positions, but it doesn't negate the 1950s, 1960s, 1970, 1987, and a 1999 facility. You look in your communities, some of you, and especially if you said, yep, there's millages out there for law enforcement. Every one of your communities will support a police millage and support a fire millage. Some of your communities have built new police stations and you don't see any problems in your community or people will support the police. Some even say, look, I built a new facility. Let's even expand it because I need to have a bigger facility. But when it comes to the sheriff's office, it always seems to be a hard sell to try and get something done here. And again, this is a once in a lifetime opportunity. Boy, I worked for Dr. Amboyer. He was our jail administrator and he hired me. And if you look 38 years later, that man still has passion about Macomb County, about the Macomb County Jail, not only the inmates remanded to the county jail, but also the workers, the staff that work there. And I'm just as passionate as him because we've been going over this for the last 8 or 9 years. So I can tell you, and I only ask that you give it consideration and push this through. Because if it doesn't go through, then I guess the question I would ask each one of you, and you could tell Jamie Cook from the Macomb Dailies, what is the solution? Give him the solution. Give me the solution. How are we going to fix it? Or just say, we're not going to fix it. This is what we're going to live with. And if I know that this is what I got to live with, then, we're going to have to work with it.
If we had those new cells in the jail, that deputy last night who was beat up by that criminal, would he have been injured?
It probably would have had a better response time because it'll be a mental health unit, which would be more of directed supervision where there'll be additional staff. So easier to get to, but is that going to stop this new facility, going to stop assaults on staff? No, they're going to happen, but it's going to reduce. Direct supervision has shown that it makes it a safer environment, not only for the inmates, but for the staff.
Exactly. Thank you, Sheriff. I have no questions for you. And Dave from CMH came up and told us that there is a lot of activity on the streets of mental health, that they are proactive on the streets, offering mental health to the community. We can always use more, but sometimes they've got some innovations going on and more planned, which is helpful. We can do both. We don't have to do one at the expense of other. I mean, there's programs, the innovative programs that some of us on this board weren't even aware of that they're doing, that they're out there being proactive. They got the money to do it. But we need the jail, that's our responsibility. And expanding the programs out on the street is also important. And we need to do both at the same time. When it comes to financing this, I think there's some confusion about when we issue bonds. We're issuing revenue bonds. Doesn't mean a tax. Now, often many of us in our communities hear a bond, we go, the local school district is going out for a bond. That means it's going to be a millage question in a local community to raise money to pay for that bond. This county, because of the excellent financial stewardship we've had over the decades, we've got a healthy fund balance. We can afford to issue a revenue bond. We pay for the cost of that bond with our existing revenue, the existing level of taxes that we pay, that the residents of this county have paid. Because we are in an excellent financial shape, we can afford to go issue a revenue bond to pay for it. $50 million, our bonded indebtedness is very low compared to most municipalities in the whole country, for that matter. We can afford a $50 million bond if that's what it comes to. If that's what it comes to, but we don't know. We're ways away from that yet. We may get, as we said earlier, we may get money from the state, we may not. But even if we don't, we have the ability and the responsibility to make that bond to pay for this facility because we need it. We need it for so many levels. For the poor people stricken with mental health that are committing crimes, to the people in our community that are being victimized by them and others because they're breaking laws, to our employees who work in there who have to manage that population. They need it. I mean, it's a no-brainer. We've got money coming in from the federal government. It's going to pay half of the money, 3/4 of the money. I don't understand what the reluctance is to do something when we've got the money before us right now to do it ourselves. And thank God we do, because of the good management this board and prior boards through the decades have done. The time to act is now, in my opinion, my friends, and we've got the ability to do it. And if we have to issue a bond, we don't have to raise taxes to pay back the bond. We got the money in our existing accounts to pay it back. We don't have to ask the taxpayer for any more money to do it. And that's a good thing, because I don't like to spend money, and I certainly don't want to raise taxes. And then we could go through the charade of saying, well, we're going to put a bond on the ballot and let the taxpayers decide. Let the people decide. Well, we know what the answer to this county is going to be. It's going to be no. And we'll be right back here again, going through the same process again. Oh, and by the way, the taxpayers are paying the bill for the litigation that we keep losing over at the jail, because we've got people in this facility that was built in the 50s and portions of it. So I think the way is clear. It's clear for me, and hope it is for the rest of you. Thank you. Thank you, Mr. Chairman.
Commissioner Zinner.
Thank you, Chair. I agree that the jail needs help desperately. As I said the first time I went there with Sheriff Wickersham, I came back and said we shouldn't put any more money into it. We should do a new one, a new jail. Nobody talked because they'd already tried that for several years. It definitely needs to be replaced, a replacement project. And I think I'm glad that Dave was here to explain how the intake/evaluation center can be of help to the people who have mental situations. And I know that our citizens, that there are lines waiting for counseling. That's been for many years now. So I'm very concerned about how we're going to get the professionals that we need for this, for the mental situations, the criminals. There are 3 areas: mental situations, criminals coming in, and the drug situations. Those are the 3 areas that will be coming in. But I think, I guess we'll find a way. I think it's a great idea. Everything will be evaluated, dealt with in an area. Decisions will be made. They can be going and getting help there, maybe help other places and in the facility. We have a lot of chaos, or an X amount of chaos, and needs in Macomb County right now. We have for a couple of years, and it's not getting better for a lot of people. Some people are doing fine, but a lot of them aren't. And as Commissioner Hall said, we've had people in here that serve food for people. There are over 1,000 people from last month. There are needs. So I'm not looking forward to voting to take $50 million out of the general fund. There are just too many factors of concern that could happen, that could befall us, the state, the country, Macomb County. It's all about Macomb County and our citizens. So I like Commissioner Van Sickle's idea of finding a way to take steps in building and plan it all out if there's a way to do that. I like the idea of getting it done any way we can, because it needs to be done. We all know that. Thank you all for explaining things. Thank you, Chair.
Commissioner Perna.
Thank you, Commissioner. Commissioner Hall made a great presentation to this body and to this Board of Commissioners. I think we really need to listen to what he said and also what the sheriff said. This problem's been going on for many, many years. I remember back in 1996 when I was on this board, in 98 and 2000, and we talked about a jail renovation at that time. And we put it off, and we put it off, and we put it off. And here we are now, 2023, talking about the same issue, that perhaps we could have corrected that at that time, but we didn't. Things weren't like they are today. So please listen to what Harold Hall said. And Commissioner Van Sickle, when you brought up the idea that if we go out for bonds, this could be a tax increase, I'm not going to correct you, but it will correct you that it's not going to be a tax increase to the residents of Macomb County. And please reconsider your consideration that we need to do the right thing. It's not popular. There's no tax increases. And we give the sheriff and we give the community what we need for our residents. Thank you.
Okay, seeing no one else on the first round, a couple things that I noted and just wanted to bring up. Many of you know that I'm in real estate, and I think that when I have a conversation with a client, the question always is, when you're going to a closing, is it going to close? And it's never closed until you receive the check in your hand. We're under the anticipation that the state is going to be giving us $50 million. But we don't have the $50 million in our hand. The question I want to ask all of you is that if you were making that decision on your home, would you buy the next property if you didn't have that check in your hand? That's the first thing. The second thing is, Commissioner Haas stated in regards to Public Works and how many questions related to the jail. He's absolutely correct. The difference, though, is that Public Works is a $30 million net plus in their request. And the jail is anywhere from $0 to $100 million negative request. So there definitely is a difference there. I think there's good dialogue here today. There's more speakers, so I'm not going to take more of the floor. We're going to go into the second round. Commissioner Lucido.
Thank you, Chair. So first of all, in response to Commissioner Hall really quick, I was told at the last meeting that we would still have to put money into the tower every single year. So I think we're still going to be putting Band-Aids on a big part of this project. So I do think Band-Aids are still going to be happening. But beyond that, my question was, does the county right now have any existing bonds out?
We have one construction-related bond issue from 2015 for the central campus renovations, and we have two bond issues related to the retiree healthcare funding. I sort of set those aside when I think about our bond indebtedness and our bonding capacity, because if we weren't paying debt service on the retiree healthcare bonds, we'd be paying premiums.
Right.
So aside from those two issues, we have about $23 million in one issue outstanding related to construction.
Okay. And my second question was too, so on here, it says, right now, we're expecting to use about half of our general fund towards this project, on top of the ARPA funds, and then the potential of probably bonding out 50 million, because I don't think we're gonna get 50 million from the state, but as like Commissioner Sabatini said, until we have that check in our hand, I'm counting on not having it until it's in our hand. But my question is, you mentioned that you didn't think that this would probably come to bid underneath this amount. What's the chances of it actually coming up higher than what you guys are expecting? Is there a chance of that? So could it end up being that we might need to bond $60 million?
It's hard to tell a year from now. We have an escalation in the budget. I think it's $9 million, something along those lines. It's hard to tell. I mean, I think costs could likely go up, but I can't tell you for sure.
Well, potentially it could end up being
Yeah, and I would say relative to the $50 million, will we add $50 million to the fund balance over the course of the next 2 years? I would probably say no. Will we add some of that? Yes. We run, I would say, healthy surpluses every year almost. We reported a little over $14 million in 2022. That's part of the 106 that we're starting with. Is it reasonable to expect we might put somewhere in that range, maybe a little bit lower every year? I would say yes. So we may not have 50 million over 2 years. We may have 20 or 25.
Right.
I don't think that's unreasonable to expect.
I think that's all I have. Thank you.
Yeah. So, relative to your question originally about the indebtedness, so the debt service on those construction bonds is about 3.7 million a year. Those bonds roll off in 2030. So at some point in time, if we have to issue bonds today or next year for this project in 6 years or so, then that debt service rolls off, and you can think of it as being replaced by debt service on this project, depending on what the principal is.
I'm going to recognize Commissioner Grote. I don't know if I missed her on the first round, but she did
No, I
not
just
speak.
put my name. Thank you, Mr. Chair. Couple comments. This is a huge project, which I think needs to be scaled down. You guys have to sit down, sharpen your pencils and scale down. It's a huge project and a lot of money, and the funds are not there. Like Commissioner Sabatini said, if we don't have the check, we can't count on that money. The ARPA money, I am all for it, use it for the project. The other stuff, it's not there. The way it's presented is too big, and it's not, I will be voting no on it. The way it's presented is just too much money. Even the ARPA money could be used for different things. I know the jail needs improvement, I was there. But the ARPA money, that's a huge amount of money, and we're talking taxpayers' money. So please take it under consideration, and I would love to have a plan in front of me that is a little bit different, and the amount of money is just too much. Thank you, Mr. Chair.
Heard your comments.
Commissioner Nard, second round.
Oh, I'm on there. I thought I got my name off. Well, I hear everybody saying that it could be more. Is it possible it could be less?
In terms of total project cost?
Is it possible that, you guys can work something out as you're going through? And you know how sometimes you do projects and you may budget for 50,000 and
I suppose.
and sometimes it could be less than 50,000. Is that a possibility?
Bring the architect up.
I'll say, and then they can add to it. It can come in less based on bidding, and we've already seen that with a couple bids coming in. But for scaling back, this is our plan. I think we're on our 4th iteration in the last 4 years, Sheriff, at least that I've been involved. Prior to that, this is our plan. We're not gonna scale back. We need the central intake and assessment center. We need 1 floor for general population. As you've stated, we're not taking down the tower. The tower is staying. If you want us to take down the tower, that's gonna be the $500 million that was already reflective. We have come back, we have tried to use everything of our resources to make something palatable to bring to you. We understand it's a difficult project, but yes, this is our job. This is what all of us are here for. We're the experts, as some of you have said. This is our plan. We've scaled it back. It's a great plan because we've taken time. We've now pulled in other aspects of it for programming. But the programming that Dave talked about doesn't necessarily exist today because we don't have the physical facility to even do that programming in. We can't bring those people into settings to give them mental health treatment. And I'm not talking just about the beds, about the actual programming, to have one-on-one consult sessions with mental health professionals, to be able to do detox. There is not the physical space within the facility for that. So that's why I wanted to stand up and preface that. Mike or Andy, if you'd like to add about it coming in, but this is our plan. We will not be coming back with the scaled down plan where we're removing the 4th floor, changing the number of beds. There's a courtroom in the facility. We have office staff that is in there in addition to that. So it is a very large proposal. We're conscious of it. Our job is to bring projects to you and plans utilizing the best money. When I've stood here before for grant dollars, we've talked about grant money and bringing grant money in for projects, for things that we have to do. We have to be very careful with grant money. When we're looking at supplementing, we can't supplement. This is a project we need to do that we need to have grant dollars for. And yes, in the grant funding, one of the other things we've learned to do and that we also had to go and fight with the federal government for was dual use. I remember after 9/11, we got money for radios. Biggest issue with 9/11 was the lack of radio communications. Federal government said, we'll do that. For those of you that were here, you remember, we were in the midst of our great radio project that this board supported. But a lot of local jurisdictions didn't have radios. They said, yes, you can buy radios, but you can only use them if there's a terrorist incident. Doesn't make sense. It's not good use of taxpayer dollars. So we went back to them and said, we need to use it every day. We're doing the same thing with the ARP funds. It's justified. It fits within the ARP. We're taking care of a physical facility that we are responsible for, as well as building in other aspects that help with the mental and substance use issues and are really going to set us apart and really improve the services that we have, the lives for the people that are in that facility, that include all of our employees that work within there. Thank you.
Question.
Commissioner, hold on. We don't have the floor here.
That is what I wanted to hear. And that's why I asked that question, because I realize that this is very important. You get what you pay for, and I'm believing that we're going to get what we pay for. And the ticket is high, and I do understand that, but nobody's life, I mean, that money couldn't replace anybody's life. So one life being lost or injured permanently in that place is worth what we're doing. And so I'm in support of it because I believe that the people that are in charge of it and have thought this out have done this with great thought, great care and concern, and they have the county's best interest. And as Commissioner Hall said, they're the experts, and I'm going to go with the experts in this case here. Thank you.
Commissioner Hall.
Thank you, Chair. I want to follow on Commissioner Van Sickle. What is the timeline? I thought we talked almost 2.5 years. Is that correct?
It's close to, from start to finish point, really almost 5 years.
5 years.
If we started now. And that's to construction that's then also getting the technology in, moving the people in, finalizing everything. But yes, it's a 5-year plan, basically.
So what you're asking is to approve a plan with a commitment that makes these funds available. In the next year, I'll even give it that, we're gonna know if we get $50 million or not. This is an incremental involvement. We're not writing anybody a check for $225 million today.
Correct.
So I sure understand the difference between the 40 million that Candace asked for and what you're asking for on the jail. Neither one of you are gonna get a check tomorrow for that amount of money. This is a commitment that can be reviewed, can be changed if the circumstances change. If the state says they're not gonna give us the 50 million, then obviously we're gonna have to look at Plan B. Right now, tell me if I'm wrong, you're asking us for approval of a plan with a commitment that this is going to take place in the future over a period of time.
Correct.
That was a good answer, Vicki. Thank you.
I know I can go on.
Secondly, our sheriff, I believe, correct me if I'm wrong, Tony, told us that if these, what do you want to call them, improvements? I know you don't want to call them replacement, whatever you want to call them. Thanks.
That's broken, you need to fix it.
If these replacements don't take place, you're going to have to start telling our local PDs that they can no longer bring prisoners there to that facility. Didn't you tell us that?
I don't know if I know I had a conversation with Commissioner Van Sickle, we spoke today, but yes, we've been working on this for 6
No,
years.
that was during your presentation.
Oh,
You
my
had said that, 'cause
presentation,
I
yeah,
wrote it
we are
down.
doing a central intake model right now. Again, all police departments, with the exception of the city of Warren, Shelby Township and Clinton Township, are bringing their prisoners to my jail.
Mhm.
And we are assessing them, we are supervising them, and in the morning, we're getting them in front of a camera and getting them arraigned with their district court judges. So, right now, those communities that are bringing it are not watching prisoners in their facility. Their police officers are out on the streets and the communities. Actually, Sterling Heights did add additional police departments or police officers because they shut down their jail and saved money. But again, if this doesn't go through and we don't have a fix, the buildings, again, it's a bad building. I'm already shutting floors down because I'll refuse to use them just by the liability and how far away they are for supervision. I'm gonna shut things down, and if I have to, then I might have to go back and just say, hey, by law, I'm only allowed to take prisoners. I only have to take prisoners after they are formally arraigned. And so City of Roseville, open that jail back up. Sterling Heights, open your jail back up. East Point, open your jail back up. St. Clair Shores, Roseville, Fraser, you guys hang on to your prisoners till after they're arraigned. Once they're arraigned, I'll bring them on in, then it's my job. But we've been working. All these communities believe in this. All these law enforcement officers, executives believe in this. Say, look, this is the way to go. This is helping us out. We do not have to supervise these prisoners. They're bringing them up when we do the work, because we are the county, right? We're providing, I don't have police officers in Warren, but I house a lot of prisoners from Warren.
Yeah, you do.
And I'm doing a lot of work for the city of Warren. So just keep that in mind. That's
So,
something
to
that's on
summarize,
the radar, and I don't want to get to that
You're actually
point.
saying you're helping out our local PDs today, which could end if this doesn't take place.
Right.
Did I hear that?
I don't want to be up here and saying this is going to be the threat. I just want you to keep that in the back of your mind. And again, I did. I at a Macomb Chiefs luncheon, last Macomb Chiefs luncheon, I made that ask. I told them what was going on and some of the concerns here in the board. And I thought it was very important that those local police officers or police chiefs in your community should reach out to you and tell you what the value is so you have an understanding. Because again, I know every one of you go back into your communities and you support your police department 100%. Whatever those leaders want, you guys are behind that. But those local officials give them everything they want, and that's great, because they should support law enforcement and they should support fire. But you guys all have to remember, we're law enforcement, we're corrections, we're the Navy. We've got everything that we do here for Macomb County, and we help every one of your communities.
Thank you. And I know Commissioner Perna referenced this has been going on for a very, very long period of time. I'm going back to the $450 million that was proposed a couple years ago. Again, it was let's bond, let's tax, and nobody wants to do that. But I do want to point something out that you said. We pay you to protect us. What are we doing to protect you guys? What you're asking is just not, I'll go back to Don again, the term intake center doesn't do anything for me, but we have officers working there. We toured that facility, from the cement falling down, to the pipes leaking, to the people sleeping on the floors. You're our representatives. You're our safety net. We all applaud you. We just went to your ceremony where you gave out awards to the officers for the wonderful things that they did and deserved every one of them. It's you guys in Brown are saying our facility is unsafe for us to even be there, let alone an intake center for those of need. So either we support our people, the police, as we do locally. I think I looked, every last local millage for police and fire passed in the last 2 years. We're your local municipality when it comes to the sheriff's department and the sheriff's building. We own it. You're our employees, you're our safety net, and you're saying we need help. I can't say that enough. And matter of fact, I've already said enough already, because it's been referenced 3 times. I don't need that. That's all I have, Chair.
Commissioner Van Sickle.
Thank you, Chair. Just a couple things. One is the new intake center
I see his light.
will not replace the tower. It will replace pieces of the tower, correct?
Yes, it'll replace the booking desk. It'll replace the maximum security facility, which is vacant and was built in the 60s. It will replace the original jail, 1954, which is currently our mental health area. It will knock off the rehabilitation center from the 1970s, and it'll knock down a separate wing, which was called the Annex, which was our work release program, which we don't do anymore.
So the pieces that are left, we're still going to have maintenance dollars every year on those pieces, will we not?
You're gonna have the tower, so, yep, you're gonna have.
So from that point of view, it isn't eliminating any of that. I totally agree. We need an intake center. We need to do something to help your department and to prevent people from getting incarcerated if they really have mental health issues instead of criminal intent. On the other hand, I'm really sad that the executive's office won't reconsider any kind of give or take on that, because as Mr. Smeagol mentioned, and I was corrected that we won't have to bond to raise taxes, we can do a revenue bond, but Mr. Smeagol estimated that it would be about $3.7 million a year to pay for that revenue bond. We could do some good things in mental health for $3.7 million a year if we threw that against the mental health area. So I would prefer not to give that away in interest. I would prefer to do an intake center that we can afford. Maybe by moving a piece of it, can we block it up a little bit, build one thing, but have a piece of it be phase 2 or something that we can pay for in another year? I would make a plea to the executive's office to consider something along that line.
and I respect that, Commissioner, but again, I would have to say, if you look at what we've been doing for the last 6 years, the projects that we brought forward, the amount of money that we've spent with our consultants and our architectural that this board approved, you know, you gave me and my team the money to look and say, how do we fix this problem? And we came back in 2019 with a solution, which was a whole new sheriff's office, jail, administrative section, detective, courtroom, the whole 9 yards. But obviously, COVID hit and we didn't move forward with it. I think the board at that point reluctantly, and I think we could have got a vote to the people, but it just wasn't the right time. Now that we're in a different position, we have less population. Like I said, we still have the problems because the facility is terrible. I'll keep using that word. And we have a solution. We have a solution to make a start at a problem that needs to be fixed. And at 3.7 million interest, this project doesn't go guaranteed, whether it's me or the next sheriff into the future and who's ever on this board, I can guarantee you somebody's gonna sit up here and say, you need a $500 million fix and figure out where you're gonna get 500 million minimum. I can guarantee you that.
I agree, the real answer is a new jail.
Right. And again, I've heard people say, you know, let's put it out to the voters, you know. If you want to, you know, Van Sickle, Commissioner Van Sickle, you run and you lead that. Whoever said about putting it on for a millage, go ahead. Go to the public and be the public eye and say you want a millage to fix our jail. I challenge you there.
Are you looking for support for a new jail?
Look, however we can get the job done. If you guys want to go on out, Tony Wickersham has brought the
Sign me up, I'll
the
go
problem
help.
back, but I'm not going to ask for the millage because I did that before and it doesn't go well.
Maybe
So
we
I
can
brought
put
you guys
together-
the best project that you can vote on that doesn't cost our taxpayers anything.
Maybe
That's
we
what you
need
got
to
to
put
remember.
together a coalition to go ask for a new jail and advertise it properly and educate the people why we really need it.
Commissioner Coalition.
A commissioner coalition.
Yeah.
Go get them.
Thank you, Chair.
Commissioner Wallace.
Thank you, Chair. Thank you, Sheriff, for your insight. It's been very, I received it well. So thank you for all that you've added on today. Dave, put those steps in, my friend. So I know Vicky talked about the space, and I completely understand that. And she said, you know, one of the reasons why we need this space is so that we can implement some of the things that you have said. So if this intake center does not go the way that you are all hoping, does your list get thrown out the door?
The projects that I mentioned could continue. I use the word collaborate, so we would collaborate with the police department and the jail services. The location offers us a way to maximize our efforts to intervene with those individuals with mental health and substance use. Oh, please.
Dave and I have gotten to know each other very well over the last couple of years through our partnership with the Community Corrections Program. The CMH staff that are working in the jail are working under my supervision, collaborating with community mental health. So from the understanding of, you know, will some of those projects be able to go on if the new places and pieces of the jail are not put into play? No, they can't. So in terms of us being able to have, and somebody has spoken about it earlier, about having those individual, and some of it is and some of it isn't, I should say that. Us being able to go into the mental health unit and have individuals with folks that are behind.
I'm sorry, you said no, it can't?
There are pieces of it that cannot. There are pieces that could
So-
go forward and there are pieces that could not.
So Dave's list, that he gave to us, you're saying some cannot go forward.
There's a difference, I guess. I was speaking to the outpatient community-based services. The expanded services in the jail would be dependent on the new space.
I get that. So the things that you're saying, this is in the jail, needs to happen in the jail, of course. That wouldn't happen if there is no portion of the jail that we're talking about. But I'm talking about the 24/7 help, the diversion you're working on. Those are
community-based programs.
so. Then the answer is
Our
yes,
ability,
they
again,
could go forward.
when we're talking about the intake portion of that and being able to identify those issues of mental illness for individuals coming in is hampered right now by our ability to be able to see everyone and have an appropriate place to be able to do that. So again, it does still impair our ability to be able to identify those folks and be able to get information to the courts to be able to divert them out into those programs quickly.
So is this a situation where uh, if this board votes no, then the community won't get any of the help? Or kind of like if we vote no and if we vote no and we said, well, maybe come back with something a little less costly. And Vicky said, well, no, this is what we have. So are you saying the same thing? If this board votes no, then the items that we have are gone? You're saying, no, we won't be able to do that for the community because we need this intake center to help those that are struggling with mental disorders.
I can try. There's, in my view, there's three separate issues to answer your question. We have been planning a lot of what I refer to as those community-based services. And we have every intention of continuing to work and plan on those. We have the opioid settlement dollars, which were a separate topic and a separate presentation. Some of those could continue as well. The services specific to the jail, the screening, the services, the diversion rate up front would be dependent on having that capability within within a physical space, which we currently do not have available to us.
Okay, yeah, that makes sense, and I appreciate that three-part breakdown. Helps my brain be able to function, put it kind of in order. So I keep saying last question, but this is it. This is the last question. So again, is there any outlook from your perspective of the items that you spoke about, the screening and things like that? If there is no intake center, they will never be able to be screened. There's no other place for you to work with, people to be screened at any point of their fight with mental disorders.
Through the legal corrections police department system, no, that would be difficult and that would be a long time coming too. Yeah, I don't have any current plans in that area.
Speak to the microphone. You're tall and it's hard to hear you. There you go.
I'm sorry, I'm
gonna
stepping
correct
back. It would not be easy to do it all, and we don't have any current plans in that area to address that.
Okay. All right. Well, thank you both for answering my questions. It does kind of complete the picture that I'm looking for. So I appreciate all of you that have come and answered all of the questions, and there's still more. But I guess Dave, you can add those steps up. I appreciate it.
Making me work.
Commissioner Perna.
Yes, thank you, Commissioner. I hate to give Commissioner Hall all this support, but what Commissioner Hall was saying, let's move this forward, okay? It's not a commitment today that we're going to be spending this money. So let's move this forward. But I have a question for the architect, Mike. We talked about, the question from a commissioner here was, the cost could go up, the cost could go down. Based on what's going on in the economic conditions right now around the world and the United States, most likely interest rates are going to be going down. Most likely. And that is going to affect the cost of this. Am I correct?
It could have an impact, and at this stage in the project, we're at conceptual level, right?
Right.
So we have a conceptual design, we have a conceptual budget. Within that budget, there's some contingencies, there's escalation. We're trying to account for these market fluctuations. We're pretty comfortable with the numbers, but we never know until bid day. I mean, it's always a question. Vicki mentioned a project recently for the county that we actually did that came in well under budget. It was fantastic. It's not a huge project like this, but it's a sign, I think, of things are starting to stabilize.
But the trend continues to go down. This is going to be in our favor.
For sure, and I was just at a National Architects Conference in San Francisco last week. Right off the hot of the press, the material prices are continuing to decline, is what I heard. But you know, labor is still trending upwards slightly, but there's going to be somewhat of a stabilization moving forward. Is what we were told as design professionals.
All right, thank you.
Thank you.
Any else, Commissioner? Chair Brown.
Getting back to Commissioner Van Sickle's conversation, we don't need this, we're not going to spend the money right away. I mean, it'll be phased in. We start the project, we get this thing going off the ground. We may not need $50 million 2 years from now. And in that time, we could also budget, we're in charge of the budget. We can set money aside to build towards that $50 million if we need it. So we would not have to bond anything at all, regardless of whether taxes the taxpayers or not. We still could fund it out of our own existing budget and set money aside over time if it's a priority of ours, and I think it should be. So I think it agrees with what you want to see accomplished. By approving this project as proposed, we can accomplish what you would want to see. I think most of us want to see. We don't want to bond for anything. We don't have to pay cash. We just paid cash for the boathouse out here, and that went over budget too. But we handled it because our finances are in good shape. Approving this project as presented will accomplish the same goal. We can get there by approving this plan as it is. We don't have to cut anything back or reduce anything. We can pay cash for it. We don't need all the cash right now. We've got time to put that money aside to take care of it. And if in the end we do need money and we don't have the cash saved enough, well, maybe we could bond a part of it. But we've got other opportunities. The state's one. Some of us have started a conversation with our federal delegation about money that might be available to help support this project as well. So we've got time, and those things take longer. The further you get away from the state, the longer it takes to get appropriations to us. But, there are things that are seeds that have been planted, some at the state, some at the federal level, and maybe those things will come along. But if they don't, we still got time to save money to come up with that $50 million in our budget over the next couple of years to accomplish it. But accomplish it, we must. It's clearly that we must. We have no choice, commissioners. We have to do something with that jail for all the reasons that have been cited here. And yes, mental health is important, but law enforcement, to rehabilitate people so they don't go back on the streets breaking into our homes for drugs and other problems is a benefit for every person in this county. We all want safe communities, and this will help us get there. So we can have that, and we can pay cash for it, but we got to prove, we got to get off the ground. We got to get projects started, and when they bring back the plans and designs, and we got bids, we'll have better numbers, and we'll tell them to sharpen their pencils and say, guess what? Maybe there's ways that they could do it to take another closer look at what they're designing, like you, Commissioner, said many times, sharpen the pencil. We don't need marble, we could use brick, you know, and other things that they could do to try to save money on the design, because you guys are very skilled at what you do, and there'll be some innovative ways, and probably the technology that's out there will probably change, and maybe there's some new innovations that you could come up with that we can in place in our design of our jail. But this is where we've got to begin, and we've got to get the ball off the ground. We can't do it all. I know we all want to change the world with one flu swoop, but we got to make incremental progress to get there. Many needs in the mental health community has been all that's been brought to the surface, and our community mental health is doing that. There are many initiatives that many of us didn't even know about are happening right now, and more are going to be continuing, and they're going to be done in concert with our diversion intake center that we're going to be building. It'll get started, and it'll give them help, and it'll help the people that need the mental health help. It'll help the people in the community not being victimized by crime continually by the same people, and our employees. Our employees will also have a safe environment to work, and they don't have to worry about whether they're going to come home at night and get assaulted by someone because they're operating in a facility that's outdated. So let's move forward, commissioners. Let's move forward and approve this and get this thing off the ground and get started. And when budget time comes, we'll set some money aside for the $50 million that we may need in the future, a couple years down the road. We've got the ability to do that. We all say we support law enforcement. Well, here's the time to put it on the table. And let's do that. Thank you, Mr. Chairman.
Commissioner Romano.
Thank you, Chair. I think each and every one of us appreciate everybody's opinion, each and every opinion that's been said on this board. Everybody has an opinion, and we're all entitled to it. And I'm proud to say that we all respect everybody's opinion. You know, in a perfect world, there would be no criminals. We wouldn't have to worry about this. We wouldn't be sitting here talking about a jail. But every single day, and I could take the Macomb Daily right now and open it up, and you're going to find somebody who committed a crime, was mentally ill. It's just, it happens every single day. And it bothers me when I see that, and I have an opportunity today to move this forward. Setting all that aside, you know, the Department of Justice is looking over our shoulder too. I'm not going to go into it. I don't want to get into the jackpot with them because they know that we have a crumbling jail. They know that we have a lot of problems with our jail, and I don't need them here investigating our jail. When we make a step forward, maybe that's the point that they'll return to where they're supposed to be back in Washington, hopefully. If I asked every one of these commissioners, every one of you, are you for public safety? I have no question in my mind. The answer is yes, we are for public safety. I, for one, do not want to be the commissioner that says, no, I'm not for public safety. I know it's going to cost a lot of money for this jail, but I just feel it's too much money, and public safety is not first on my list. That's all I have to say. Thank you.
Okay, seeing no other speakers for today on this item.
Motion on the floor?
So we have a motion on the floor.
No,
to-
wait, can you please read the motion, please?
The motion is to receive and file and forward items 6C through F to the July 18th Finance, Audit, and Budget Committee meeting. Please vote.
Motion passes 10-3. Commissioners Lucido, Romano, and Song voting no.
Thank you, everyone, for being here with those items. I know it was a couple hours there, so obviously we have more business to conduct here today. So next item on the agenda is 7A. These are department recommendations. First one is purchase Robert Half temporary staffing for Finance Department in the amount of $84,000. I need a motion to recommend this to full board.
Motion to move to full board.
Support Nard.
Moved by Lucido, supported by Nard. Steve?
Good afternoon, Commissioners. So what I'm asking for today is the authorization to spend up to $84,000 on temporary staff to assist my office in moving through the Workday project as it relates to upcoming end-to-end and parallel testing in the months of July and August. Just trying to, the idea is for those folks to come in, learn our processes so that we can then backfill staff in my office that will be needed during the testing process. And there's a lot of validation, data validation that will need to happen as well. So that's my request. It's up to 4 staff. I don't know if I'll need all 4. I think 2 for sure, but looking for authorization to have the money available in case I need the additional 2 people. We're going through payroll end-to-end testing now, and it's a very time-consuming, intense process.
Steve, was this in your original budget with the Workday conversion?
No, it was not.
Just curious why this wasn't in the anticipation with the conversion. I know HR, I don't think they've asked for additional staff, but you are.
What I'm seeing is through the payroll, the implementation of the HCM and payroll, that I'm probably gonna need some additional staff. I've got some staff shortages now as well, so I'm in the process of filling the last 2 positions in my office. A 3rd person just started a week ago. I have 2 vacancies in purchasing, so I have some staff vacancies that I'm working around as well. And I think last week when we were here talking about this project, I don't think we could just imagine, we just couldn't imagine how time-consuming it was gonna be.
Okay. Seeing no speakers, please vote.
Motion passes 10-0.
Thank you.
Next item is item 7B, Ordinance 2023 for the fiscal year 2024 June year-end funds budget appropriations ordinance. I need a motion to recommend this to full board.
So moved by Nard.
Support, Van Sickle.
Moved by Nard, supported by Van Sickle. Steve?
Nothing new or unusual about this request. It happens every year in the month of June. It's appropriating 25% of the current year budget for 2 programs, some at Community Action as well as Chris Riley's operation at Employment and Training. So we do this again in September for the funds that started in October. The idea is to appropriate dollars for those operations to continue until we go through the whole budget cycle and adopt the formal budget in November or December, whenever that happens.
Seeing no speakers, please vote.
Motion passes 11-0.
Okay, next item, I'm gonna take a motion for C and D together. C is purchase Gorno Ford, 2024 Ford Cube van in the amount of $59,495. And item D is purchasing a 2023 Ford F-150 pickup for $43,252.
So moved by Nard.
Support Wallace.
Moved by Nard, supported by Wallace. Nicole?
Hi, everybody.
You have waited.
This is the 2nd month in a row.
We got you twice.
Put them
Okay.
together for you.
So the first one is the warehouse truck for our central receiving. It's just the warehouse truck that they use to take and receive things, bring things from department to department. It's pretty old and dilapidated, just needs to be replaced. This was actually budgeted this year in their actual budget, so the funds are already in the purchasing budget for this.
Okay.
And then the other one is an F-150 for MATS, which is the undercover auto theft department for the sheriff's office. They get some funding from the state, and then they have some funding in their budget left over. So this was actually part of the pre-approved items that were back in August as well.
Nicole, have we looked into like a fleet program rather than purchasing all of our vehicles, doing a like kind of a lease option?
So,
Do you know?
yes, actually we have. I actually spoke to Enterprise. They actually reached out and they wanted to do it specifically for like the sheriff vehicles, for like their DB vehicles that they,
Mhm.
cause you know, they have a lot of, I don't know, probably quite a few vehicles that are not actually marked vehicles. The problem comes with, it's a two-party title. So we would actually pay for the vehicle less, you know, whatever amount we didn't want to finance through them, but we have to at least not finance some money because they have to be on the title. When that happens, then they will buy the lease back from us and then resell it, and then there's those funds. So I did talk to finance. I spoke with Steve Adair about it, and he had heard about it before. It just gets kind of hairy with like the receiving of the monies because they're not going to auction. It's a private sale.
Right.
So they don't really like that aspect. Finance doesn't. They,
My community has done something similar, and we've saved a lot of money in Macomb Township, so that might be a good resource to reach
actually,
out.
yes, they have said that they do that in Macomb Township, and I believe, I forget the other one right now, but there was a couple of them. So yeah, we can look into it again if you'd like that.
Chair Brown.
I approved both of these items. I want to ask you the question about the truck that we authorized purchase of for the animal control.
It's
Has that
out.
been delivered?
Yep, it's already, they're picking up carcasses.
They are?
It's actually going tomorrow to get graphicked. So, but in the interim, we've just stuck a couple stickers on it, and they've been going around picking up carcasses and things like that.
Have they been using it 7 days a week, or, because there's a lot out there that hasn't
I
picked
have
up.
no idea exactly how
Oh,
many.
anyway,
I do
it's
know.
delivered. It's at your
Well,
job.
I do know that, per their contract, I know that a lot of, like the deputies can't actually go pick up them because I think there's something in
Yeah,
their contract.
It's okay. All right, but it's been delivered, and they've got it. Thank you.
Yep.
Commissioner Van Sickle?
Thank you, Chair. Hi. Just a curiosity question. I see this first vehicle is with attic. What's an attic? Is that
Okay, so
the,
it's a cube van and it's the little part over the cab. So instead of it just being a box on the back of the truck behind the cab, there's like a little part for extended storage on top of the,
Oh,
on top of the
okay.
cab. So it kind of extends over.
thank you. That's it, Chair. Thank you.
Thank you. Seeing no other questions, please vote. Thank you, Nicole.
Thank you.
Thank you, Nicole.
Thanks for your patience.
Thanks, everybody.
Motion passes 10-0.
Okay, next item is 8A, open bids as of June 13th, 2023. Need a motion to receive and file.
So moved by Nard.
Support Van Sickle.
By Nard, supported by Van Sickle. Any questions? Seeing none, please vote.
Motion passes 9-0.
Next item is public participation. This is the opportunity for the public to speak for a maximum of 3 minutes on any issue. Anyone from the public? Jamie starts, but he didn't finish there, so we're gonna go once, twice. We'll close public participation. Next is commissioner comments. Mr. Kraft.
Thank you, Mr. Chair. I didn't speak today, so this is going to be my time, but I want to thank all the commissioners for talking about this a second time. This project is a lot of money. If you look at it in perspective, I was just talking to Commissioner Wallace, this is the cost of almost the entire year of the CMH's budget. And for the county budget, it's almost a quarter of our budget. I mean, this is a massive project that deserves our respect, our attention, and all the questions and answers that we receive. So I personally appreciate the time that we're taking to kind of, pump the brakes a little bit because it is such a massive project. We will come to a decision, and we will come to a decision in short order, I'm sure, but just wanted to convey my thanks. My questions were answered at the previous meeting, so I didn't have any today. So thank you. Thank you, Mr. Chair.
Seeing no other speakers.
Motion to adjourn.
Support Zinner.
Made by Romano, supported by Zinner. Please vote. Thank you, commissioners.
Oh, I
See you tomorrow.
Zinner, yes,
Good job,